based on their proposed budget. Human Services matching grant, that is $829,844. The proposed cut is 100%. That goes towards safety net services, so Covenant House for Youth Emergency Shelter, Alzheimer's Resources of Alaska, Abused Women's Aid and Crisis Emergency Shelter Program, Rural Cap Sitka Place, Rural Cap Safe Harbor Muldoon, Catholic Social Services Brother Francis Shelter, Catholic Social Services Clare House, and Beans Cafes Adult Shelter Meals and Social Service Referral. So all of those programs will not be funded starting in the next year round based on that proposed cut. In addition, in public health nursing, we anticipate approximately a $400,000 cut to that grant. We also anticipate a 40% cut to the Medicaid receipts. We are applying that higher level because the cuts that have been proposed by the governor's budgets are unallocated, and there's a couple focus on dental programs, but the lion's share of it is unallocated, so there's really no way to predict where that cut will come or how they're going to distribute that in the system. So we're going to assume that level of cut. In addition, the ADRC Medicaid administrative claiming program, we're still working to understand the cut, but it states 100% cut to the Senior and Disabilities Medicaid Services line. We don't know for sure, so we're planning on trying to wrap this up by the end of the week and have a really solid understanding of what the cuts will be to the department, how that will impact community service, how that will impact receipts to the city and to our administrative overhead. So that is our update for now. Do you guys have any questions?
This is about ordinance I'm introducing that's coming to public hearing will be the 5th of March. It changed the age to buy cigarettes, tobacco to 21.
Oh, great.
Instead, across this country, it's called tobacco 21.
Okay.
We've had 9 states adopt it, I think 421 cities. So I'm working on the SE with that because it'll impact the amount of money we get on tobacco. If we reduce that by people quit smoking, I'm happy with that. I'm working on the AM, but I've got scheduled to be in the Assembly for a first public hearing on the 5th of March.
Okay.
So I want you guys to know about it.
Great. Well, we will work on our policy position. We actually were just discussing that particular policy internally and talking about recommending it to you guys. So glad to hear. So you already got it all wrapped up.
Wherever they are.
Great. Thank you. Yeah, it's one of the standard best practice policies for states across the country and on healthy cities, and so it's one of the ones we were going to be looking at since we obviously already.
I'm also introducing more on vaping.
Okay.
When the ban cigarette smoking of any kind, whether it's vaping or tobacco or marijuana in any city parks. So I anticipate that'll get some attention.
Great.
Things I want to get done before I do the body.
Okay. Thank you.
Yeah, I have plenty of ones that government budget for that.
I'm sure we'll have lots of conversations about that in the future. So,
Okay.
thank you.
We can then thank you for that report, Ms. Pineda. I appreciate it. I think we can move on to 4As. It looks like it's not Heather and Matt, it's Matt and Petra. So you have a presentation for us?
Yeah, so first and foremost, I want to say I'm not Heather. So the board accepted Heather's resignation as of February 15th. We are working with 4Acre to prolong that executive process, and we have an interim in place. In the meantime, Heather left 4A's in a really good position, and we have no necessarily, hopefully will not affect any of our programs, and we're working to move slowly. Great board. So for those of you that don't know, 4A's, the Alaskan AIDS Assistance Association, is kind of the main AIDS service organization in Alaska. So in Anchorage, we provide HIV care and medical case management to individuals living with or affected by HIV. That includes case management services. We do a lot of housing for clients, mental health and substance abuse counseling for individuals that are HIV positive. We also do nutritional supplementation. We also do a lot of outreach in the community. We do free HIV and hepatitis C testing. We partner a lot with the Anchorage Health Department, and we're very fortunate for that partnership. We partner with Identity, and we do testing events throughout the community. One of the really important partnerships, I'm sure you all know, the increased rates of gonorrhea and syphilis. We're really trying to partner with these organizations that can help promote free testing. Matt will hit on, we're going to talk about the 4A syringe access program predominantly today, but I wanted to make sure you guys all know what else we do in the community. We also have a couple of events coming up, so look for his Facebook page from our community events. We're very excited. We just hired a new staff person to focus on community outreach and free testing. So welcome Zane Davis to the team, and that's kind of what I have, and I'll let Matt talk about 4A Syringe Access Program.
So I brought a single handout, which basically shows the numbers that we're seeing. It usually expands a lot more, but it's just kind of the core numbers for the different services that we offer. So for this first table here, kind of shows our mobile locations, because we started a mobile unit in July of last year. And so it's still, we're still within the year for this pilot project. And we're still going pretty strong with it. So as far as the numbers, at the bottom here, it shows that we've collected over 760,000 syringes and have given out 745,000 clean syringes along with supplies. The year before last, I think we collected just over 700,000 and gave out 630,000 syringes. We're anticipating doing 1 million this year, just because thanks to the support of the money, the $50,000 we got, we were able to up our limit from 50 to 200 syringes, which is really a win-win all around. Folks are needing to come see us less. They're getting the syringes and supplies that they need to last them for maybe a month. They're not reusing, they're not sharing. They're disposing of them properly as we give them sharps containers.
So that doesn't necessarily mean that drug use is going up. It
Right.
just means that they're not reusing the needles.
Yes,
It's more-
yeah. Our focus, of course, is that they're being as safe as possible.
Right.
So using that harm reduction method of, we understand drug use is a problem. People use drugs, they inject drugs. So they can come to us without the pressure of treatment. Like, when are you going to call these places? When are you going to try and get in treatment? It's more of, we're between prevention and treatment. So we're helping folks that are in the position that they're in, and they're just needing maybe some guidance, maybe a place just to talk to somebody without feeling judged or being forced into an option they don't want. And that's kind of what we provide. They can come in and we can just have a regular conversation with them, especially if they're new. We can let them know what we can do for them and offer services.
Mr. Trini's question.
Question, we participated with your program last year when the city gave it. Are you getting any state dollars now? Because I'm concerned the state cut back. That may be wiped out. So how much money did you get from the state last year?
So the state funding goes directly into testing. It doesn't go into the syringe exchange at all.
Again, how much money did you get from the state?
We get approximately $70,000 from the state, so it used to be a lot more. We got almost $200,000. When the structure of how the Ryan White funding was distributed to states changed a couple of years ago, it went by incidence. So Alaska is a really low incidence HIV state, which we're fortunate for that, but we saw that cut in our prevention funding. So I think you guys are probably aware they did lift the ban on federal funding being allocated to syringe access programs, but that funding was not able to go towards syringes or supplies, which are our most costly part of the program. And so, like, if we took $50,000 from the state, that would cut from our other prevention budget. So we decide all of our state funding goes toward our HIV test kits, and our outreach materials for that program. After Matt talks, I'll talk a little bit about how the syringe access program is funded, but it's primarily private foundation grants, individual asks, and last year was the first year we were fortunate to receive funding from the municipality, but that was actually the first public funding we've received.
I appreciate that. I think coming up this Saturday at the Ed building,
Mm-hmm.
10:30 in the morning, there's caucuses coming to town from Juneau. Given what the executive branch is declaring on the state side, I hope you guys are going to be there to talk about your program with state legislators.
I hope so too. I hope they do.
Thank you. Thank you.
Quick clarification, the funds you talked about, they aren't really state funds though, right? They're, when you talk about the Ryan White program, that's federal block grant passed through to the state, right? So it's
Correct.
federal and state. So really the state doesn't have a lot of skin in the game at this time.
I know, but the skin they've got is going to be gone, so I'm trying to tell you.
Yeah, a lot of, well, Patriot will go into all the other funding, but it's a lot of foundations and private donations and stuff for the
Petra,
exchange
not
system.
Petra. Petra.
Correct.
But so from that first table, you can see that our mobile unit is doing really well. We have lost some locations, and you know, it's really just a learning process. As we lost 2 places, and so we've walked away learning what we need to do better. A lot of it was communication both ways, but you know, I'm glad that we're able to at least get a little bit of that data, have a few additional locations so that we can show that it's actually a need, people are using it. And of course, we still go out to the Valley twice a week and offer services out there. And then we're working on some other strategies to go a little bit further north as far as peer distribution, so working with folks that are in recovery or that use the program. And then so we have HIV testing. This has also gone up a little bit since we started the mobile unit. Folks are feeling a little bit more comfortable getting tested on our mobile health unit. And of course, that's a part of this program, is to offer that a little bit more by going to the population, going to these locations where they otherwise would not be able to come to our office to get tested. So we did 738 HIV tests. We didn't have any positives this last year, which, from what I understand, is kind of all the organizations are seeing a lot less positives. So Hep C, on the other hand, we did 330 tests. This is kind of a mix of at our office and on the mobile unit. And we had 62 positives through that. So with that number is always about the same, it seems like. And a lot of that is due to folks sharing syringes, things like that, when we try and educate as much as possible on how to prevent that. And then, so then we kind of get into the program, FastApp itself. In June, we started a new data intake process. So in the past, as someone would come in to use our services, we would just get demographic information, so their age, gender, zip code, things like that. And we did that every single time that person came in. So there was really no way of distinguishing that person from everybody else. So then in June, we started an ID system, and now we can say that we, at least up to this point in December, we've had 2,093 intakes. So that's 2,093 unique individuals. We're almost to 2,700 now. We're definitely, we could hit 4,000, which is kind of what we've always estimated as far as the number of unique participants. So that's 4,000 people that we are serving. And then we still log the number of actual exchanges. So we did 19,000 exchanges. The previous year we had done 23,000, I think. And so that that being lowered can be attributed to the number of syringes we're getting out. People are needing to come in less to use our services. And then along with that intake process, we started asking what folks identified as using. So heroin, meth, a combo, anything else, as well as their housing status. And so with those numbers, it's pretty, there's a lot of individuals that use both. I was really surprised, actually, that use both meth and heroin. And then as far as using heroin only or meth only, it's kind of balanced a little bit. And then with housing status, stable housing, most people identify as having stable housing, so that could be renting or living with someone or something, that have a roof over their head. And then 460 people have identified as being homeless. We have noticed a lot of people, we anticipate a lot of people wouldn't feel comfortable answering these questions, and a lot of them don't. So we do have a lot of like others or declined. We have 753 others, which someone had just said that just something that we weren't asking them. And those are for our program. It's a simple program. What we do, we offer HIV and Hep C testing, education, get all condoms, resources, materials, referrals. But it's an important one. The impact that we've made on people's lives. Every month we use client stories that we've heard, and we have years and years and years worth of client stories. And every month it's hard to pick which one to use because somebody would come in that hasn't been in for almost a year and they're clean now. We may not even recognize them because they look so good. They look so much better. And so it's those stories that really keep our mission and focus on helping people. And whether, if somebody isn't wanting to go through treatment, at least we are a place for them to go and talk and ask questions and get the supplies and stuff that they need so that they don't become HIV positive or Hep C positive or get a terrible abscess that can lead to something else that could cause their death. So that's really what keeps us going with this program.
Thank you.
So I did want to touch a little bit on funding. Last year we were very fortunate with our board granted us the go-ahead to purchase a mobile unit. And with funding received from that, we made an ask to the Assembly and received a $50,000 grant and to pursue our mobile unit. And that's kind of what you see, the numbers that Matt just reflected. Our two biggest local funding sources are the Mat-Su Health Foundation and the Alaska Mental Health Trust Authority. We're very fortunate to have long-standing partnerships with them, and they've been really invested in this program. A lot of the rest of the 4A Syringe Access Program to run this small department is about $270,000. A lot of the rest of that funding comes from outside private foundations, kind of small patchwork grants, and then private solicitations that we do. I think one thing we're really proud of is that we have started asking for about a year and a half now. We ask our participants to make a small donation, a donation of any kind, and they contribute like almost 15% of our budget, which is great. Just $1 a day or a couple cents. They think that 25 cents doesn't add up, but we get a lot of quarters that make a really big difference, which is really neat. And I'd be happy to answer any funding questions you guys have. We understand that the $50,000 grant isn't necessarily an every year thing, so we are looking into unique funding streams and trying more sustainable funding streams for sure, and open to any suggestions one might have. Yeah, that's kind of that.
One thing we've looked at the projected cuts in the city budget, we're going to lose $6.1 million on revenue sharing. So it's going to be a fair time for the people that are on this subject. But I'll let you know.
You're leaving at the right time. Or not, depending on how you look at it.
That's how you feel
Now's
about
the
it.
chance to.
Appreciate the heads up.
Okay.
There's one question that should be asked. Last year, this time, you guys had some legal troubles. And that came at exactly the time when we were asked to give you money. And even though that was very publicized, we did continue to fund. We opted to fund despite that. And so can you give, without causing any legal harm to any parties, an update on how that's working and kind of controls inside your organization and what's going on?
So I can certainly give an update on controls inside of our organization. We have tightened up our financial controls. That position no longer has access to a credit card, so it was credit card fraud that was the predominant source of it. And we now do much more intensive. Our board goes over our credit card receipts at the board monthly meeting. So we have a lot more eyes on the credit card. We've limited the number of positions, so now we only have 2 acting credit cards in the agency. We have also tightened up controls on access that position has to funds. Unfortunately, that position was also acted as our rent payee for our HIV care clients. So that position and that process has tightened up a lot more with more financial controls on it. 4Acre also, they act as our financial controller. And then Altman Rogers does all of our financial auditing. And those individuals, we've had many many meetings with them to how to tighten those controls, and so we're feeling more financially stable. We are still in the court process, so that necessarily
To go there.
hasn't been resolved, but it's
Thank
a little
you.
bit of the update.
Thank you.
Yeah.
Any other questions? Okay.
Thanks for having us today.
Thank you
No,
for
we
coming,
appreciate the opportunity
especially
to
while you're
educate.
in transition.
Yeah, no,
at your
absolutely.
work. We appreciate you.
Show
being
goes
here.
on.
Yeah. Great. Okay, it looks like next we're going to have a presentation by the Health Department on environmental health.
And just a comment as we're getting ready, I just wanted to share, number one, when I talked to Suzanne about this Jason said this is going to be like an overview of the program, knowing that there's some members who aren't here and others that have lots of interest in different areas of things that we do in environmental health, and so that we're happy to come back in April and do longer, like if this generates a whole lot of questions, please get them to us and we can actually come and do a more in-depth, intensive into certain areas. I know that Assembly Member Dunbar had interest in vectors and hotels and a whole bunch of areas that we didn't get into in this presentation that were like political hot buttons. We're going to review all of the things that we do so that you're aware of it, and then we can come back.
Okay.
More intensive.
Yeah, Mr. Training.
We're going to have two members. So let's suggest after the election, we know who they are. You have a presentation on that, because you know at least have two new members.
Okay, so I just wanted to make sure that you guys knew this was more of a foundational setting opportunity for the team to share with you what the full expanse of what environmental health does, because really a lot of people don't know. And then we're happy to kind of do the, kind of like we did with animal control, where we knew there were some really big items that the public was very interested in and going to depth in those. So I'll let the team.
Thanks, Natasha.
Take over.
And just so you guys know too, I think Felix is aware, but I've been asking Barbara if after we're about to have quite a few new members after this election, that we do more trainings with the assembly, sort of in an organized way, work sessions or whatever, so that we're all.
It'd just be good to bring them earlier in their term.
Yeah,
on the
I
subject
agree.
Rather
than have to
years
pick it
later.
up along the way. Yeah, I agree. So thank you, Mr. Train. Yeah, thanks.
Hi. So I'm Jeff Hickman. I'm the acting program manager for the environmental health program, and I brought Janine down there, and she helped write the slideshow. So and she is our plan reviewer. So public health is working for all of us all the time. So we have the 10 essential functions here, or the 3 cores and the 10 functions of public health, and our program touches just about all of them. We work, mostly with enforcement of codes and education of the regulated facilities and public on food safety. We have air quality, food safety and air quality, and then we investigate complaints and foodborne illnesses. So those are kind of where we focus in this wheel. The environmental health program is responsible for permitting and the routine inspection of all food facilities in Anchorage and the municipality, that from Eklutna to Portage. And we're responsible for implementing the programs that help improve air quality. We rapidly respond to complaints of all sorts. We provide education for regulated facilities and the public on food safety and air quality, and many other issues when it comes up. Our program is made out of, it's kind of divided up into 3 different sections. We have a customer service section, which has 2 full-time employees, and they're our main interface with the public. They sit up on the front counter all day, and they handle most of our phone calls that come in and redirect them to inspectors. They provide information to people who need it. If somebody wants to know how to make a new restaurant, how to start up a restaurant, they can provide them with all the information for that. If somebody has a complaint about something, they can collect the information. If somebody needs to do a temporary permit or a change of ownership or any of that kind of stuff, they kind of deal with all of those things. They collect all the fees. They mail out all the permits. If somebody has trouble with food worker cards stuff, they help them get set up with that. We have a computer up front, and they kind of keep that going when somebody needs to use that because they don't have a computer at home, and that sort of thing. So the next part of it is, the next section in our program is air quality. We have 2 full-time staff. We currently have 1 vacancy there, and they're in the process of hiring that position. But that positions, those people are responsible for publishing the air quality index. We hear that on the news, and in the springtime we tend to have problems with dust and stuff, so they're responsible for kind of keeping that dust under control and calling in the mag chloride trucks to, smooth down the roads so that they don't cause a air quality violation for us.
Yeah, sorry, Mr. Train, go ahead.
Sure.
Spring's gonna come eventually, and inevitably we have people dusting off their parking lots. Now, there's a city requirement they spray them down with water before they do that, doesn't it?
Yes.
That never happens. Could you get more publicity out on that? Because normally what happens is we get complaints all the time. Big dust clouds coming this way. Why aren't they putting water on the parking lot before they sweep? It's required.
Yeah, and
need
when
more
we get those
publicity.
complaints, we have our one air quality inspector, and he goes out and chases those guys down, and he'll write them a ticket if they don't comply. But that's our goal, is to make sure that people do follow the rules. If we see it, he goes out and proactively prevents it when he can.
Sounds
But
like Mr. Trainee might be asking more about
What I
public.
ask you to do is just
getting the
get
word out.
publicity as we get towards breakup time.
to send letters to
And it's
people.
not just parking lots, it's churches. Say
Yeah.
that it's got a flat surface of parking lot. They're required to spray water before they clean
Sweep it up. Yeah.
And when they don't, it just flows everywhere.
I don't know, he was
Sorry.
asking, no, that's not, he was asking if you wanted to send letters. I don't know that that's what he's recommending, probably social media, public, just sort of
However
general
you guys get the
outreach.
message out, I'd
Yeah.
like you to be a little bit more active than
We
I've seen in years
we can
past.
do that.
Get
We
the
have
message out.
our PIO could probably assist us with that, Facebook and.
Yeah, thank you.
Just
Mr.
other
Constable.
a note
methods.
on that, in case you missed what he said there, our 1 officer for
Yeah.
a city of 300,000 people. And so from an enforcement perspective, it's pretty darn limited.
We used to have a lot more, but
And
now we're down to
chasing
1.
clouds is hard enough. We
Yeah.
know
Well, Chris, it's not gonna get any better,
I
so
know.
we need to get the message out on social media.
I'm not disputing, I just want to make sure that little gem was raised up in the conversation.
So they also administer grants for the Anchorage Metropolitan and Transportation Solutions, the AMATs. The bike that encompasses things like Bike to Work and the Plug at 20 campaign and other kind of projects like that to promote clean air and alternate methods of transportation and all that. So we also respond to air quality complaints and also related to odor, smoke, and dust. So that's part of what they do, is respond to those parking lot complaints. And they enforce AMC 1530, the Clean Air Ordinance. We issue the open burn permits, like to the airport and to the fire department. And they do the air quality conformity analysis every year, which is taking all the data that's collected from the monitoring stations and turning that into a report to analyze how we're doing.
Question?
Sure.
Yeah.
What's the fine from EPA if we exceed our air quality allotment?
I'm not sure that there's a fine, but it would cause other problems with having to redo the SIP. But we haven't had a violation in like 20 plus years, I'm thinking.
Since 91.
Yeah, and a violation is 2 exceedances, so to get that, it's pretty tough even.
Also, to answer, Chris, what happens is, if we declare a non-containment area, then we have to go to the federal standard, which is everything from
Yeah. it gets-
MTD in your gasoline to doing the auto emissions program we had for a couple of years till we got rid of, we finally made air quality. We've been really fortunate because the new cars don't blow air quality. It's the old beasts that are out there that do it. But we've been really fortunate. Now, the Matsu, on the other hand, has a problem with air quality particulate because they use so many wood stoves up there, and they're gonna probably blow the federal requirement. Then feds will come in and put mandatory compliance steps on.
Yeah, Fairbanks is kind of going through that now with wood
They have no
smoke
choice.
and people burning wood to keep warm versus cleaner methods like natural gas and stuff like that. So
Just as a sidebar issue, I have heard from our roads people that they get big fines if they don't meet their air quality, if there are clouds coming up, so they get out there and spray the roads down. And so maybe I'm getting kind of steered in circles, or maybe we have another kind of pathway that we have to be considering. But I have heard.
Yeah,
that
I
they
know.
get fined.
we haven't had an exceedance even with dust in a long time. We've had, where it gets to be close, but I don't think we've had an exceedance since a long time. And that's what when they see the numbers, when Matt sees the numbers crawling up, he immediately gets on the phone and he calls over to DOT and they send out the trucks. He tells them where to go and they go and they take care of it, and you can see the numbers just drop on the when you look at them. So he's right on top of that, and that's kind of what he focuses on, especially in the springtime. And even when you get in the winter like this, you get those inversions where it's clear and dry, and then that dust will start to come up, and sometimes you have to even spray in the winter. But
Can I ask a quick question just about burn permits? So can you get a burn permit within the municipality, even in tight, sort of dense residential areas, or is that?
I'm not that familiar with that part of the program, but my understanding is that the burn permits are pretty much only the airport and the fire department,
okay.
and they're special permits, and they have to go all the way up through the director.
Okay, yeah, I wouldn't think.
Yeah,
that
to be
you could
to
get
be.
small resident.
We had an ordinance that passed last year that addressed the issue of personal burn permits, and I think we made it pretty damn hard across the community, even up on the hillside to do it. And so there's some recent code changes that have addressed that.
Yeah, and there's a lot of rules to have an open burn permit, and there's a lot of things they have to follow, and there's plans in place, and it's a quite long letter they have to submit to request one.
And
So
the counterpoint to that is that we effectively reduced our, what do they call them, the place where you take wood?
What?
the woodlots.
The wood lots. And so at the same time as we're taking away a place where people can take their wood, we're telling them they can't burn it. And so we have a responsibility to figure out how to deal with that, because the wood up there is a hazard, if it's under control.
Yeah.
Because there was one on C Street down by that area.
Yeah, by
You could
Cabela's.
drop your wood off. There was no problem. Every now and then, it comes spring break, people will find wood.
They run into the else.
Yeah.
I know we've reduced.
Okay.
They chip a
Thank
lot
you.
of it up and make it into just ground cover. But
Yeah.
a lot of wood chips down.
They've even opened them up, and we've had disasters too, and when all the trees fell in the windstorm and stuff like that. So,
Okay, thanks.
yeah, the main part of our program, the biggest part of our program, is the food safety and sanitation section, and there's we have 5 inspectors for that, and they're responsible for inspecting 1,850 plus close to 1,900 food restaurants and pools, spas, retail marijuana, and then in the summertime we get around 500 plus temporary food booths every year that have to be inspected on top of all of that other work. Just this weekend there's probably 20 or 30 coming up with Ferrandi, so we're going to have 3 guys out on Friday just doing temporaries at Ferrandi. So they also respond to complaints related to noise, secondhand smoke, smoking in restaurants, smoking too close to the door, any of that kind of stuff that comes up. Mold in hotels, pests in rental housing, beauty barber shops, rat complaints, restaurants.
Mr. Cheney has another
Oh,
question.
I'm sorry.
Mold in hotels. I'm told there was an incident where somebody recently just reported mold and they got fired. I guess there's a rally going on yesterday or today.
Yesterday.
Of the workers there. You guys might have got a message on that.
We did.
Because they reported the mold as they're required to do. But apparently they took adverse action against the person who reported it.
I don't know anything about that. We haven't had a mold complaint in probably a year and a half. So
if I might, the scenario there was the guy at the beginning, and they fired him, and it's been litigated through the National Labor Relations Board and found to be in violation by a pretty conservative NLRB. And the press conference yesterday was at the kickoff of the trial in the federal courthouse. So it is now in litigation, and but the NLRB found that illegally fired him.
So I think what Mr. Cheney's maybe asking is if you're not finding mold, but there was mold there, right?
Yeah.
How is that?
well,
It hasn't been reported to you, is that what you're saying?
yeah, I know probably the place, and we've only had one mold complaint, and it was at that place, and we went in there, and it was addressed like, I don't know, a year and a half ago.
Okay,
We haven't
yeah,
had
that's
any
probably it then.
we haven't had any more complaints since then from that place. So
Okay. Thanks,
One
Mr.
second, going
Cheney.
back to the smoke, do you get complaints about the bus barn? Because Felix and I have a community council, University Community Council, and they're always complaining about the inversion that happens with the smoke coming out of the bus barn there. Does that ever work its way to you guys, and you go check it out?
no, I've not heard of any complaints. You mean like the Like out at Tudor?
Yeah.
No, I haven't heard any complaints about that. Now, we know that on the test site there was some issues where they were thinking about moving it to,
If
and
somebody
then
has a complaint, what number do they call?
343-4200.
For 200?
Yeah, that would be back to air quality with that one.
Okay. We'll send it to the Diversity Community Council. Your phone will get busy. Because every community council will hear nothing, no, Felix, but the problem of the smoke.
Yeah, and we can only be reactive on those things, and so we can't go chasing them down. So we can only know if it's a problem if somebody tells us.
Yeah.
Thank you. Thanks, Austin.
Yeah, thank you, Mr. Cheney.
I threw a picture up there, kind of the stuff we kind of run into now and then. That was from about 7 or 8 years ago. That was a hand sink that hadn't been used in quite a many number of years, and that was pretty bad. So we see stuff like that all
In
the
a
time.
restaurant or something,
Yeah,
or-
the picture
okay.
right there at the bottom.
Yeah,
Yeah,
you look at it.
that water's kind of black.
Oh, that's water. Yeah, it's
Yeah,
hard to tell.
yeah, that's water in a hand
Wow,
sink.
okay.
A hand sink that wasn't being used properly.
Remember Jed Calambo hitting oil or something?
Yeah, it was pretty bad, and that should have been a hand sink they used quite often, but they said, "Oh, we don't use that," and that was quite obvious when we did the inspection. So, and then we also have one plan review staff, which is Janine right down there, and she's responsible for reviewing all the plans for new and remodeled food facilities, retail marijuana facilities, swimming pools, spas, for compliance for 1616 and 1615, the pool and the health code, and perform the initial inspections once they're done with plan review. And that's roughly around between 100 and 120 facilities a year just for new and remodel facilities to review.
Can I ask a question?
Sure.
Janine, how do you work together with the municipal clerk's staff on these licenses?
Oh,
Or-
I am part of City View, so they get assigned to me, and I research to see whether I answer for the health, Bainbridge Health Department.
Okay.
And so I research to see if they've got current permits, or if there's any outstanding fines with us, or if there's any outstanding issues that we need to address. If they need to come in and get plan review or go through the permitting process, and then I talk with the applicant to let them know that these things need to be taken care of for me to approve.
So you're one of several things
Yes.
that, like the fire department or
Yes.
something that then, okay,
Yeah.
thank you.
And we just recently resolved the disconnect we had in that process, and we're in the process of revising the flow of how the marijuana permits work so that steps don't get missed, because we ended up having a miscommunication at one place and some steps got missed, and it was everybody thought somebody else did it kind of thing. So now the workflow has been revised so we don't get skipped anymore.
Okay,
So
thanks.
Quick question on that.
Yeah.
Did you see an applicant for a coffee cart inside of a marijuana retailer at this time?
I
Yes.
have not seen
You haven't seen
anything
the
through
application
not through the licensing portion, but I have seen it in plan review.
So it has made enough, okay.
we've got 3 or 4 that are trying to do, that are going that route, and it took us a while to hammer down what that process is to allow that through AMCO and then through the Muni and then through us and then building, and it becomes quite a bit of an ordeal when you have to retro it in. If you've already got an approved license, you have to go back and fill out a specific form at the state, and then you have to do that same form at the city. It has to go back through City View, and then everybody has to sign off on it again so that they can get that part added. So
Mr. Cheney has another question.
I don't envy your job, because if the state decides to authorize on-site marijuana consumption, that would fall in violation of our secondhand smoke ordinance. I would not want to be in your position, because you're going to have more work to deal with.
I think that's a debatable point, though, because we do now have one tobacco store that has figured out a legal way to allow.
And that's fine, that meets our requirements for secondhand smoke. I'm talking about.
right, the private club
If
method.
marijuana starts
I'm
doing
not
it,
sure
they know it works,
Yeah.
all the regulations, and we got problems.
Yeah, so I wouldn't presume that we'll be trying to circumvent the secondhand smoke ordinance. I would presume that these very industrious entrepreneurs will find a way to do it legally.
Well, I don't think we're going to get to that given current
True,
restrictions.
I don't disagree with you.
And that's
Right.
Mr. Constant, just for the record, responding to Mr. Cheney. Okay.
So, and you guys would also have the ability to not allow the secondhand or the on-site consumption too, right? You don't have to, The assembly could make the choice to not allow it at all, or to only allow edibles or
Local option.
or something like that. So, but whatever you decide, we'll figure it out. And then she also does conditional use permits and special land use permit approvals, noise permits, and special activity permits. Like if you want to close down the street to have a concert, has to go through us, because you'll probably have to get a noise permit to have that concert. So she has to sign off on all that kind of stuff too. And then the last position is the standardization officer, and that's one full time. That would be what my normal job is. But that's responsible for tracking progress on the 9 FDA program standards, which involves things like inspection program, having a uniform inspection program, having trained inspectors, having a standardized food code, and things like that. So, and it's that position's job to report that program data back to the program so that data can be utilized to help do things better. Also responsible for training and standardizing field staff and auditing field inspectors, desk audits and field audits, and also apply for and administer FDA grants when we get them. So you guys will be seeing 2 of our grants coming up shortly in your list of things. And other things we do is we permit and inspect beauty and barber salons, beauty salons and barber shops. We issue noise permits. We permit and inspect habilitative care facilities and correctional community residential centers, the CCRCs. And we also permit companies that apply pesticides. And we also educate regulated facilities and provide educational materials to them to help promote food safety. We also do foodborne illness investigations. We have, when you get an FBI complaint, somebody complains they got sick at a restaurant, then that gets assigned to a district sanitarian for investigation. And then we also coordinate with the epidemiological nurses in the health department and to do food interviews and conduct investigations and collect samples if that needs to be done. If there's an outbreak suspected, then the state becomes involved, and then the state epidemiological section will come and help us conduct that investigation. A good example will be this summer where we had the Vibrio parahemolyticus outbreak, and I came through a lot of Anchorage restaurants, and then the state led that investigation, and we just assisted them in collecting the information they needed to figure out what was going on.
Training?
How often do you let the public know the FBI's have? Do you just keep it quiet, or do you actually let the public know?
Well, we have a lot of just single, like one-off, where it's just one person complaining, and those ones we just investigate them and close them out. But when you get a big one like the one that the state had that had 20 some odd people with Vibrio parahemolyticus from shellfish, then those tend to be reported in a press release. But the state takes the lead on reporting the big stuff.
Yeah, sure.
I think the most famous or infamous example of that was Beans Cafe, when there was the incident of blood that kind of moved all around the inside, and they ended up having to shut down for a month, 3 weeks. I think the state came in and took control, and it was quite a scene. So I do recommend you change that to FII. You can do whatever you want, but FBI creates a connotation of something else altogether. And foodborne illness investigation, although it might be fun to say FBI, it really is setting me up to think something else is actually happening. So just a thought. An FBI complaint says something else to me all the time.
Oh, I guess in the food world lingo, it's been FBI since probably the 70s. So, so why is food safety important? Food safety is important. The CDC estimates that around 48 million people, it's about 1 in 6 Americans, contract a foodborne illness each year, and roughly 3,000 people per year die as a result of that illness. An estimated 128,000 people are hospitalized each year with a foodborne illness, and that has an economic impact of between 10 and 83 billion, just from lost work and hospital bills and so on. And to put that in perspective, in 2016, the National Fire Prevention Association said that 3,390 people died from fires, and 14,650 civilians were injured, and 10.6 billion in property damage occurred from fires. So we're looking at, at numbers on a national scale that's roughly similar to what fires have, but they're a lot better funded than we are. So the top 5 pathogens we see is norovirus is the number one. 58% of all trackable foodborne illnesses estimated to be norovirus, and that's the one that you hear about that on cruise ships. One person gets sick, and pretty soon the entire cruise ship is sick. That's a very, very nasty one. It passes very easily, and one sick food worker grabbing hold of your burger bun without washing their hands first or touching it with their bare hands is all it takes to get you sick. And the next one is Salmonella, and then Clostridium perfringens, Campylobacter, and Staphylococcus aureus. So those are all the most common foodborne illnesses that we see. And these are the 5 risk factors that lead to foodborne illness, the 5 big ones. One is improper holding. That's not keeping your food hot enough, not keeping it cold enough. It lets bacteria grow at uncontrolled rates, and then you can be served food that's contaminated and you get sick. The next one is poor personal hygiene. That's touching stuff with your bare hands, not washing your hands correctly, then touching food with your bare hands. That's one of the top 5 ways of getting people sick. Next one is not cooking it hot enough. That will also not kill the pathogens that are in food. And if you don't cook your chicken all the way, then you can get what's in chicken. Contaminated equipment, that'd be not cleaning things correctly, or doing something like cutting up your chicken and then cutting up your vegetables on the same cutting board, or using the same knife without washing everything first. And then food from unsafe sources is getting things from places where you don't know where it came from. And you'd be surprised how many people buy stuff from a guy they know, or out of the guy that stops by, and they just get it out of their car. So we run into that more often than you think. So if we see something we don't recognize, we have to track down where it comes from and see if it's okay to even have it.
Austin, question?
Yeah, Mr. Chang?
How about all the cars we see in shopping malls that have crab for sale, shellfish for sale? Do we ever inspect those, or we just say,
We do. Those
"Have you
guys
had-"
are all permitted, and they should have stickers on the side of their vehicle or on the food truck. Have
So they are
a
all
health department permit. Yeah,
Well, they
man.
should be.
They should be. If they don't, we try. If we find them, then we chase them down and tell them they have to stop or become permitted. So
Thank you.
that's the problem with mobile trucks. They tend to leave when you show up. So. The top 5 risk interventions. These are things you can do to prevent those 5 illnesses, those 5 risk factors. Number 1 is to have somebody who knows what they're doing. If you have somebody who's had the 8-hour food worker or the 8-hour registered food manager class, and all the employees have their food worker cards, then the chances that everyone in there kind of knows how to handle food and when to touch things and when not to, and when to wash their hands and all that is something that can be trained in, and then you reduce a level of potential to make people sick. Employee health controls, that would be having an employee health policy, making sure that if people are sick, you send them home. And this is always one of the more difficult things in restaurants, because most food workers don't have sick plans, and they don't get sick days, and if they're not at work, they don't get paid, so people tend to work sick. So finding ways to deal with this is always a challenge for us. Controlling hands as a vehicle of contamination. Again, that's not touching things with your bare hands. That's using tongs, gloves, toothpicks, that kind of things, rather than grabbing things with your hands, so it reduces the chance of contaminating something. Time and temperature controls. That's keeping things at the right temperature. If you do that, then things don't grow. Consumer advisories is letting people know that they're about to eat something undercooked, or something that could make them sick. So they can make that decision on their own. In addition to just the food stuff, here's all the other codes that we enforce. There's a long list of them there. Retail marijuana, the housing maintenance and occupancy code. That's mainly, we just do the rodent and insect part of that code. Public nuisances, pests in hotels and mold in hotels. Noise control, pesticide control, public swimming pools, barber shops, cosmetological establishments, secondhand smoke ordinance, habilitative care facilities, and correctional community residential centers. And then other things such as smoking in municipal structures, rat control, human trafficking posters, and then the cost of healthcare transparency, providing estimates and having notice. We're also responsible for taking care of that too. And that's all done with our 5 inspectors. So here's our current funding. The environmental health budget. We have about $1.4 million from the general fund, and we have $3,000 to $26,000 annually. We get in FDA grants for food safety projects that we otherwise couldn't do, and that covers our program expenses and approximately 10.7 full-time employees. And then we have our air quality budget. We have the air quality awareness grants and AMAT's funding grant, about $333, and that funds about 1.3 full-time employees. So we take in about $984,000 collected every year through permit fees and plan review fees and food worker cards and all the things we charge money for. So, and going forward in the future, we'd like to continue and expand upon the work we already do, and in food safety and air quality. We'd like to see increased public and industry engagement and education while we promote clean air and safe food more effectively. We'd like to see stakeholder groups and regular meetings with the people we regulate so that we can have their input, especially when coming up with new regulations. That's something that we would love to be able to do. We would also like to better integrate environmental health issues into the emergency preparedness and disaster response planning. One of the lessons we learned from the earthquake is that nobody thought about food safety and what a boil water notice means to 1,800 restaurants. So we had to come out with that so that we could issue the correct information so that restaurants would know what they needed to do to stay open. So had this been a worse disaster where we would have had a boil water notice with contaminated water in place, then we don't really have a good plan to address all of those restaurants and how they would remain open and safe, since that's probably where most people would go if they couldn't cook in their own house. So in the future of environmental health, we'd like to work on health impacts of climate change on the community. We'd like to establish a robust vector control program that is able to do more than just reactively respond to a limited number of complaints in rental housing. And it would be nice to be able to study the impacts of toxins on the environment and how they affect our community. So,
Are there any other questions?
and we just appreciate the Assembly's partnership in procuring these additional resources and helping us by supporting code revisions and help us meet the needs of the program. And that's all I've got.
Yeah,
Thank
thanks
you.
for being here today, and it might, as Ms. Pineda said, maybe we'll ask you to come back at another time too, if you don't mind.
Sure, no problem.
That's really helpful. Okay, doesn't look like we have any additional questions. So this meeting is set to go till 2. That's a ceiling, not a goal, as we like to say. So, but if any member of the audience wants to say anything, we have a little bit of time. No? Is it? Oh, I thought it was set to 2. Interesting. Okay. Well, we're a little bit over then. Okay. This committee meeting's adjourned. Thank you.
We'll be adjourned.